in place for insurance regulation, then the only other option for insuring the public would be government insurance.
What's amazing from all the studies that have been done, everything from Social Security to Medicare, I mean, it shows that the population is so different than the very small circle of know-nothing pundits we get on television. It is remarkable, even on the issue of single payer. The polls show when explained, when not talked about as, you know, Fox put out that memo that you're not supposed to refer to it as a public option, but a government option. When people actually explain what it is, most people are for it. But I wanted to go back to this critical discussion about end of life, because it's something we don't deal with until we are in crisis. And that's when people are struggling to get information. They have the least ability to get the information, and that's when they have to deal with these issues. The piece that you wrote in The New Yorker goes through many different cases. But you talk about two studies, one that was run by Aetna and another, the whole community in La Crosse, Wisconsin. Why don't we go to La Crosse, Wisconsin, and talk about what happened there?
La Crosse, Wisconsin is a typical Midwestern community where the local doctors and a bioethicist there decided that they wanted to improve the care for people with terminal illness. And they did it by working to make sure that everybody in the town had a living will. And not by forcing anybody to have a living will, but simply by teaching everybody from chaplains to social workers to doctors how to have good conversations and to take the time to have good conversations with people about the kind of choices that they will face when, as all of us will, when they become sick.
And a living will means what?
And a living will means being able to say in advance what you desire when it comes time for treatment. Everything from would I want to have my, if my heart stops, would I want to be resuscitated? And if I had a pneumonia, would I want it treated? For most of us in our phases of life, the obvious answer is yes, please. But we will all reach a phase where we will reach a point where the suffering of treatment for the sake of prolonging life will have trade-offs that we begin to struggle with, especially as we become ill and disabled by chronic illness. So in La Crosse, Wisconsin, they had a community effort, and the result was over 90% of the population ended up having what they call advance directives, a living will. The doctors actually paid attention to what they had written down, which often gets ignored. And it was not a matter of follow what this piece of paper says. The power of it proved to be that for people with terminal illness, they had thought about what might happen as they got sicker, whether they wanted to be at home or in a hospital when the end came, how much control they wanted over their life. And by being able to articulate their values and concerns about facing that kind of illness, the two things happened in La Crosse. First of all, the number of people who died in intensive care units and being kept alive on ventilators and on machines past the point of being even conscious of what's going on declined markedly. The costs of people in the last year of life went down markedly. There was no change in how long people lived in La Crosse, Wisconsin. And it really became a model community for the entire country. They were the ones. They said the one barrier we have left in La Crosse is that the doctors don't have the time to talk to patients because they're only paid for a short visit. Having the time to talk at length to people who are really, really sick, facing a few months to live, they needed to be compensated for that. And that they were the starters of the very provision that could help people decide, do they want hospice care versus hospital care, and having the dollars and in place to make those conversations less of a burden on the medical community.
We're going to continue this discussion in a minute. Dr. Atul Gawande is our guest. His latest book, The Checklist Manifesto, How to Get Things Right, is out in paperback today. This is Democracy Now!, democracynow.org, The War and Peace Report. If you'd like a copy of today's show, you can go to our website at democracynow.org. Back in a minute.